Hi, I'm Dr. Rutherford, and we're back again to discuss what we find. We hope you find to be an interesting topic. The topic that we're going to talk about at the moment is going to be the truth about liver detoxification programs, and it's fairly a couple of the topics that seem to be coming up regularly. Oh, and this is Dr. Randall Gates. I was really wanting to frame this so I could get your interest.
You are a certified functional medicine practitioner.
I think it says that underneath.
No, it does not. It just has the initials.
Okay, I'm a certified functional medicine practitioner.
And I'm a board certified chiropractor.
And we're not Abbott and Costello here. We actually kind of sort of think we know what we're doing.
We just talk over each other the whole time.
Okay. So, and we do. So let's get back to the liver. All right, so the liver detoxification. There's a lot out there today on detoxification. There's a lot out there on cleansing. And we'll start off by saying we embrace those two methods as far as utilizing them in chronic pain issues. We largely, our practice has kind of morphed into, kind of more or less on its own, into a chronic pain, chronic condition, chronic syndrome, whatever you want to call it, type of a practice. Most of our patients that come in have been a lot of different places, have tried a lot of different models, and so we had the opportunity to listen to what they've tried and what has not worked, what has worked temporarily. And liver detoxification is high on the list of the methods that people have tried to utilize to get better. So why is the liver important? We can talk a little bit about the liver, why it's important, what the detoxification pathways are in the liver and what they actually do. And I think we can get into our experience with liver detoxification and how it's a valuable tool, but in and of itself, it usually is not sufficient to make any long-term changes. And I think that's going to be the crux of what we're going to talk about.
Mm-hmm. Exactly. So in talking about liver detoxification, just so all of our watchers and viewers out there and listeners know, our liver has many, many functions, hundreds of functions. It's incredibly important.
300 or more functions
that
they know
upwards of 500.
Yeah.
And basically, one of the key things it does is it gets rid of toxins from our body. Things that we eat primarily or things that we absorb through our skin. And it does that by a principle of taking a fat-soluble toxin and turning it into a water-soluble toxin so that you can urinate it out. If you can't do that, then guess what? You're going to accumulate toxins. And so that whole process is mediated by cytochrome enzymes. There are many different ones. The P450 is the one that is talked about extensively in biochemistry. But certain medications and certain supplements may interfere with certain cytochrome enzymes, and that's something that's also talked about a lot in the literature. And then relative to that, there's also the glucouronidation pathways, which are very similar. And so those are your general detox pathways in the liver. But again, they're necessary to get rid of toxins. However, also know that they can vary from individual to individual. And certain people they're now seeing can detox better than others. And this is perhaps a mechanism as to why some people can get exposed to heavy metals or some organic solvent and be fine, and others, you know, they walk past somebody with perfume and they drop to the floor.
Yeah. We'll do the heavy metal one in the future.
We will.
That's another topic that comes up a lot. And just to go back to that, for those of you who might have maybe flagged a little bit with the glucuronidation and that type of stuff, it's real simple. A lot of toxins come in, they get stored in your fat cells, and that's where they get stored. There's theory that a lot of the reason that a lot of people can't lose weight is because when these toxins are in the fat cells, that some innate intelligence in the body knows that if you let these fat cells go, it's going to poison your body. Whether that's true or not is difficult to say at this point in time. But those fat cells need to just be simply broken down so that they can be cleared. Two pathways, as Dr. Gates is saying. First one breaks it down, turns it into water type stuff, and then the second path cleans it out. Both of those pathways need to be working. And if they don't work, boy, the liver can give you so many different symptoms. That can be so many different things. It can give you acne, it can give you bloating. It can cause problems that might make you think that you're having menstrual problems because it's not clearing out your estrogens properly along with your gallbladder that a lot of you don't have. It's kind of a controversial thing in a sense of, when I say controversial, now I'm talking to the fatty inflammatory markers that we see relative. And when I say controversial, it's like you for the liver detoxers, those of you who may go by your medical professionals, and again, we say this every time, we're not anti-medicine, but the norms utilized for a medical doctor to really get kind of excited about your liver really is about when the SGOT, the liver markers are over 100.
Right.
Now, technically, over 40 in a lot of worlds means you either got a fatty liver or an inflamed liver, and that gets a few people's attention in the medical world, and they might look into helping you out with medications on this. But in our world, it's about 25, 24, 25, 26 kind of gets our attention. It's like something's not going on right there. And so you can have, so if you go get your liver tested and they do these enzymes, and in our world, your enzymes are over 25, you probably have something clinically going wrong with your liver. There's also a lot of controversy over the fatty liver thing. See, people talk to doctors who don't get too excited about fatty livers, because fatty liver just means you're getting, part of your liver is getting fat. It's not something that you can, that's going to kill you, they say. Right. But my position on the liver is, if it performs over 500 functions, I want it functioning. I don't just want parts of it functioning. And the fatty liver aspect of it has a lot more significance than maybe it's given to in the medical model. So just a few tidbits there about the liver itself. It's vital to everything. So many things are made in the liver. So many things are cleared by the liver. Helps to control your blood sugar. Oh my God! I mean, it's just crazy. Manufactures cholesterol. It does. I mean, it does, like you said, over 500 different things. So the liver is pretty important.
Right.
I want to acknowledge that the liver is big. It's pretty regenerative. But in other words, it really does heal up pretty well. And I want to make that point because we're going to talk about liver detoxes. And even though it does heal up pretty well, we're going to talk about the liver in response in respect to by the time the liver starts getting problems, a lot of other things have gone wrong, and that's been my observation. And we do it. We have an assessment form that we use, and we assess the organs of the body in these chronic pain cases in this order: brain first, then colon, then small intestines, specifically the ileum, then small intestines, the jejunum, and then the stomach, and then the pancreas, then the gallbladder, and then the liver. And there's a reason that we do that.
Right.
And this is getting into liver detoxification. Because all of those structures, if they're not functioning right, are dumping on your liver, essentially. Creating a problem with your liver. And so what I think the strength of what we have seen in our programs is that the liver is being attacked. Frequently, the person has bad liver enzymes, but really the liver is not sick. It's just overwhelmed by what's going on in your stress of your brain, or in the colon, or in the small intestines, or all those types of things. So, I mean, from there, I'm going to go on for the next hour. From there, you look like maybe.
No, I really like how you presented that, because that's really true. Because we started off today by determining what our subject was, and talking about a lot of our patients come in who do these liver detoxes for a couple of weeks, and they feel better for a couple of weeks, and they have to keep doing it. Well, why do you have to keep doing it? That's really the question, as Dr. Rutherford is illuminating to. It could be a myriad of things. It could be that you're in a fight-flight state all the time, or a stress response, and perhaps the neurogenic innervation of rest and digest responses to organs such as the liver may not be optimal amongst many other organs of your viscera, which are your abdominal contents, basically. And
in other words, if you're stressed out of your mind, it's messing up your liver.
Yeah. That is one way to say it.
And you can liver detox from now till doomsday, and you're going to feel good for about 3 days or maybe 2 weeks at the most, but then it's going to come back. Exactly. And I guess that's the picture that we're going to paint here, is we're not anti-liver detox, but if you're liver detox, and we can get into, I mean, you know, the classic liver detox is all work. So if you're looking for the specific liver detox, let me just tell you that the master cleanse works. If you want to do that, do it. It's been done forever. There's no detox that's better or worse or anything. That's a simple one to do. And
under the supervision of your physician, we will say that. We don't want somebody going hypoglycemic out there.
That's true. Okay, so there's a perfect example. There's a perfect example. So what Dr. Gates is saying, the liver has a lot to do with blood sugar.
Absolutely.
Blood sugar control. And in certain people, you can.
Oh yeah, we've seen it.
You can do that cleanse and possibly have your blood sugar drop.
I've seen 34 in one of our patients without diabetes or blood sugar dysregulation.
And the normal our normal range is 60 or is 80 to 100 for blood sugar for your glucose. Okay, that's our normal range. So and 34 is like almost dead.
But as you were illuminating too, it could be the brain, it could be the stomach, it could be the gallbladder, it could be the small intestines, it could be the colon. All those things, it could be your stomach acid production, really affect what the liver is going to do. And keep in mind, the liver gets all the blood flow from your gastrointestinal tract. It is the filter, so to speak, for anything that you ingest from the environment. And so it has that responsibility. So lots of times people get focused on the liver, but it's really not the liver. It's something else.
Frankly, most of our patients, it's something else. How often do we see a primary liver problem? Almost never.
Yeah.
Almost never. So let's go through some of that.
Unless someone has like hepatitis or
exactly.
We've had a few of those, but
we have people who have had hepatitis years ago, and we can talk about that.
We can talk about that.
Which will also affect your ability to detox yourself and stay detoxed. But the bottom line is that the liver cleanse is good as a piece of a puzzle. Certainly, if you are continually feeling sick and you're not even aware that there are all these other pieces of the puzzle, I mean, if you want to do a liver cleanse every month, it's not going to hurt you under the supervision of a doctor, so that you don't go in the if you're somebody who might go in the hypoglycemia. But it's a very simple thing to do, and it's not going well. Again, I guess you're right. I guess you should probably check with a doctor, somebody, to make sure that you're not going to go into hypoglycemia.
Yeah.
Because people may not realize that they're going into hypoglycemia and having blood sugar problems, and all of a sudden you're falling asleep and
you're irritable and you're shaky and
yeah.
You're saying that you don't have a blood sugar problem and you're not hungry, so you don't eat.
Right. That's a low blood sugar symptom package for you there.
Yeah.
So so we'll go through the things that we see. I mean, I've seen a couple of these in the last week, just in the last 4 or 5 days, come in doing a consult or we're doing our exam and reviewing their history, and they have colon problems. So things in the colon. If you have problems in your colon.
Yes.
If you have
leaky gut syndrome. I mean, we have talked extensively this year about small intestinal bowel overgrowth, leaky gut syndrome, infiltration of bacterial components into the bloodstream, resulting not only in immune inflammation but also insulin resistance.
You have inflammation. Now you're talking about small intestines, but if you ever go to the colon, if you've done a colonoscopy and you got any of the things that they told you you have, diverticulitis or any of those things, short of cancer,
has to be cleared by the liver.
Has to be cleared by the liver. Everything has to be cleared by the liver. Everything. This is not just about alcohol over intake. This is about everything. So if you have a colon problem and you're inflamed, you get that colonoscopy and they tell you have diverticulitis or irritable bowel syndrome because they think it looks a little red or something like that, and you're cleansing the liver, what is that doing for the colon? Well, it's not really doing anything. So, and what we try to, one of our challenges here is to draw a different perspective of alternative medicine, in a sense that um, in doing alternative medicine, we have for years said, but we're not going to give you drugs for that or do a surgery. We're going to get to the cause of the problem and get rid of the inflammation. So we're going to give you turmeric or whatever.
Right.
Okay, and we're not anti-turmeric
Or
either.
berberine.
Okay, or berberine. So our berberine, which is the new thing, and we use it. Okay, but the bottom line is that you need to keep everything in context.
Right.
And so the true getting to the problem of what's happening to your liver when you have every liver symptom that there is, but they look at your liver and say, it's not that bad, or the liver enzymes are good, is you haven't gotten to the problem. And the problem, and this may be in those findings on your colonoscopy, and it may be that inflammation. So do we take something for the inflammation, or do we find out why you got the inflammation there, fix that, all of a sudden the inflammation's gone, the colon's better,
Right.
the liver doesn't have to detox it. Small intestines is what you were just going over.
Mhm.
Oh my God. I mean, the small intestines overwhelm the liver.
It is overwhelming.
In my observation
Yeah, absolutely.
of looking at case after case after case after case of just the liver just being overwhelmed by whatever is going on in the small intestines. You mentioned several of them.
Absolutely, and we'll elaborate on that. Basically, we talked about the movie Fed Up and how, in essence, 2/3 of our population at this point is overweight or obese, and they say in another 30 years, 2/3 of us will be obese. And so from that, we can see that obesity in large part is due to insulin resistance. We're now seeing that insulin resistance in large part is due to pieces of bacteria floating in your bloodstream that shouldn't be there. And those bacteria are there, the new literature is showing, because of the American diet. These bacteria bloom like algae when they are fed processed carbohydrates, processed sugars, and saturated fats. And so many of you are running around out there with too many bad bacteria in your intestines, which are then floating into your bloodstream that the liver tries to clear, and the liver gets inflamed. And in part, that is involved in the alteration in how insulin works. Meaning, basically, most of you have too many bad bacteria in your guts that are resulting in insulin resistance, resulting in weight problems. And the liver is a key mechanism there. And they've shown that, interestingly enough, that patients who undergo gastric bypass, it actually changes the way the liver signals to that part of the small intestine then.
Right.
And so that can be a key reason why people lose so much weight. It's not just that you're eating less, it's that the liver is interacting with the intestines in a different manner, allowing you to burn fat more easily.
Right.
Which is just so cool.
Right.
Yeah.
So our goal here is to try to draw the complexity of liver. I mean, I know that in this day and age, we're looking for the simplistic approach. If you have chronic issues, and I guess this is more maybe for the patient who has chronic issues, or the patient who keeps doing liver cleanses and feels good, or has to do them every 2 weeks, or